ocular disorders associated with systematic disease. Introduction. The eye is closely related to systematic disease. Many systematic diseases can cause ocular abnormalities, such as vascular diseases and metabolic diseases. Many eye signs can reflect a systematic disease. Examination of the eye provides the ophthalmologist an opportunity to make a unique contribution to the diagnosis of systematic disease. The process of atherosclerosis occurs in large arteries. Involvement of the retinal arteries is termed atherosclerosis. Atherosclerosis is characterized by an enhanced light reflection, focal attenuation, and irregularity of caliber. The grayish-yellow fat products in the vessel wall blend with the red of the blood common to produce a typical copper wine appearance. This indicates moderate atherosclerosis. As sclerosis proceeds, the blood column vessel wall light reflection resembles civil wire, which indicates severe atherosclerosis. At times, even occlusion of an arterial branch may occur. The appearance of the fundus in hypertension retinopathy is determined by the degree of elevation of the blood pressure and the state of the retinal arterioles. In mild to moderate systematic hypertension, the retinal signs may be south. Arterial attenuation, broadening of the arterial light reflect, and arterial venules crossing changes may occur. In patients with severe hypertension, an extensive retinopathy can be seen, with hemorrhages, cotton wool spots, and occasionally cirrhosis, detachment of the retina. Severe optic disc edema is a prominent feature. Diabetic retinopathy is classified into non-proliferative diabetic retinopathy and proliferative diabetic retinopathy. Non-proliferative diabetic retinopathy is manifested as microaneurysm, retinal hemorrhages, exudates, and cotton wool spots. Proliferative diabetic retinopathy is characterized by the presence of any new vessels on the optic disc or elsewhere in the retina. If the blood vessel ruptures and bleeds, massive vitreous hemorrhage may cause sudden visual loss. Elevated neurovascular may cause vitreoretinal traction, which can lead to retina detachment. Changes in the lens include cataracts and sudden changes in the refraction of the lens. Rubus iridis stimulates to retinal neurovascularization in severe diabetic retinopathy, resulting in secondary glaucoma ultimately. Diabetics often experience the sudden diplopia caused by paralysis of one of the extraocular muscles. It usually recovers completely. The term Graves' disease due to an autoimmune process. Ocular manifestations include the following aspects. Lid retraction is almost pathologic of thyroid disease. The degree of axial formosis is extremely variable. Limitation of elevation is the most frequent finding of ophthalmopia. Compression of the globe by the orbital contents may compress optic nerve and produce retinal or choroidal strain. In severe exophthalmopia, corneal exposure and ulceration may occur. The ocular changes of leukemia occur primarily in those structures with a good blood supply. Changes are most common in the acute leukemias, where hemorrhages are seen in the nerve fiber and pararetinal layers. There are typical Roche spots. It's often accompanied by extramorphia, which is called orbital brain tumor. Night blindness and poor depth adaptation are the earliest signs of vitamin A deficiency. After several weeks, keratoconjunctivitis began to appear, and keratomalacia developed in severe cases. The ocular manifestation of vitamin B deficiency are blepharitis, conjunctivitis, and rosacea carotis. In the ocular manifestations of vitamin C deficiency, hemorrhages may develop in a variety of sizes, such as eyelids, subconjunctival space, anterior chamber, vitreous cavity, and retina. Vitamin C deficiency patients are prone to cataract. Many granulomatous inflammation disease often affect eyes. In addition to the lens of the eye tissue have the possibility of tuberculosis. Ocular tuberculosis results from endogenous spread from systematic foci. A granulomatia panniculata may occur. More than half of leprosy patients have eye damage. The symptoms were ptosis, corneal opacity, or iridoconjunctivitis. The most common eye lesion in the congenital cephalitis is interstitial keratitis. Iritis and iridocystitis occurs in about 5% of acquired syphilis cases. The inflammation may involve the posterior segment, including optic neuritis, optic disc vasculitis, and chronic retinitis. Ocular changes in patients with acquired immunodeficiency syndrome can be manifested in the following steps. Retinal changes include cotton wool spot, retinal vascular abnormalities, and ischemia macular disease. Conditional pathologic microorganism infection can occur, such as cytomegalovirus, retinitis. Ocular tumor can occur, such as Kaposi sarcoma, which is often located in the eyelid, conjunctiva, or lamicrosclera. There are also inflammation of anterior segment, posterior segment, and ocular appendages. Many systematic immune diseases affect the eyes. Ocular findings in patients of SLE include episcleritis, scleritis, and keratoconjunctivitis scare. Uveitis rarely occurs. Retinal involvement produces signs of anterior occlusion. Rheumatoid arthritis, a disease that is more common in women than in men, rarely presents with uveitis, but scleritis and episclerosis are comparatively common. The scleritis may herald exacerbation of the systematic disease. Sjögren's syndrome is a systematic disorder with diverse features. The disease is characterized by keratoconjunctivitis sicca, and extrarhomatosis. It may be secondary to a connective tissue disease, usually rheumatoid arthritis. Ankylosing spondylitis has a strong association with HLA-B27. In most cases, an anterior uveitis is seen, but in a minority, anterior and posterior uveitis exist with glaucoma and cataract developing in the long term. Scleroderma may involve in the eyelid skin, showing sclerosis and atrophy, causing eyelid closure, insufficiently reduced tear secretion, dry eye, and even symblephasia. The diagnosis of writer's disease is based on a string of signs that includes urethritis, conjunctivitis, and arthritis. Scleritis, keratitis, and uveitis may also occur. Ocular signs occur in 75% of cases of Behçet's disease. The uveitis is severe, occasionally associated with hypopyon. Visual loss is due to inflammation changes in the retinal vasculars and retina. The most striking feature of Marfan syndrome is increased length of the long bones, particularly of the fingers and toes. Ocular complications are often seen, in particular, dislocation of the lens, usually superiorly and nasally. KF rings may occur in patients with Wells disease. The ring appears as a green or brown band peripherally at the level of the December's membrane. Okay, that's all for this lesson. Thank you for your attention. See you next time.